welcome to Health Options, the very first edition in 2020. I am Rabi Abdullah. Thanks for joining us on the program. Good health remains one of the basic needs of individuals, irrespective of status in the society. This is the reason why government, as a major key player in any society, considers the issue of health as critical and fundamental. How has this played out for the health sector in 2019? A new year provides opportunity for stock-taking and time to look forward to new prospects. That's why this edition of Health Options brings you the high and low points, successes and failures of the Nigerian health sector in 2019 as we review the year. The year 2019 began on a promising note for the health sector when President Muhammadu Buhari walked the talk and rolled out the Basic Healthcare Provisions Fund, that is the fundamental funding provision under the National Health Act, appropriated for the first time in the 2018 budget since the Act was signed in 2014 and also appropriated for in 2019. The implementation of the Basic Healthcare Provision Fund took place during the launch of the Universal Health Coverage document, following which the Federal Ministry of Health issued guidelines and criteria for states' participation and the subsequent disbursement of over 6 billion naira to 15 states and the Federal Capital Territory.
One of the key things that we have taken on board since we came in June is how to make health insurance better delivered to Nigerians. We started with taking a motion that looks at the challenges in that sector. As at the time we came in, there was no leadership even in that place. So based on the motions passed by the National Assembly, the President appointed a new leader. But on our part, there was an act that was passed, a bill that was passed by the last National Assembly, but was not signed. So we are able to represent it back, and it has undergone both the first and second reading. We are able to look at why the President did not sign in the first system, and we have been able to enable or create a dialogue between all the involved stakeholders, so that this time around, I'm sure by the time we resume back in January, February, we will have a new public hearing and be able to represent for third reading, but has undergone 2 readings. The other act, but in addition to that, we are not only waiting for the bill, just as I said, we have engaged the various stakeholders, including the NHIS, the Federal Ministry of Health, and all other stakeholders in insurance, to see how NHIS will start, even before the bill, implement the Basic Healthcare Provision Fund, the component, because 50% of that fund is allocated to NHIS. We were aware that they have been able to mobilize funds to 15 states, but we said it's all 36 states plus FCT that should benefit from that fund, and we are making it. In addition to that, as Parliament, one of the things we did was to set our agenda, and we have been able to, we've held within this short time, between, I think about, specifically in October this year, we had a national summit where we invited all the chairmen of health committees of the 36 states and the commissioners of health, and all of them were including the speakers and the chairman of appropriation committee of all the 36 states, for them to be able to have an understanding of their role in making health insurance to work in their state. We'll be able to see that so far we have about 30 states that have enacted appropriate law for NHIS. We still have 6. Those 6 that are outstanding, we are providing necessary technical and other support to them for them to be able to do that. So this is what we are doing as far as health insurance is concerned. I think in the next quarter of next year, it's our hope that most of these activities that we have engaged in the last quarter of this year will become will come to fruition, and Nigeria will start to enjoy better health insurance across board.
The National Demographic and Health Survey indicates that the efforts of the National Primary Healthcare Development Agency and partners saw the push of the needle of immunization coverage in the right direction, registering an increase from 38% in 2013 to more than 50% in the year under review. Still on child survival and immunization, 2019 saw the visit of the delegation from the Global Alliance for Vaccine Initiative, Gavi, considered as a welcome development as it comes after a dark period that saw Nigeria closed out of Gavi support due to misuse of funds meant for vaccine procurement and health system strengthening, detected between 2011 and 2013, which the federal government had to repay as the country was at the verge of losing funding support for its routine immunization program. The 2019 visit of Gavi to Nigeria was seen as timely and showed the restored confidence that Gavi has in the leadership of the health sector. In line with Gavi's health system strengthening objectives, the Gavi leader, Dr. Saith Beckley, launched cold chain equipment at Alaita Primary Health Center to help improve vaccine storage. Nigeria maintained its no-wild polio status in the year under review, with a higher guarantee of getting polio-free certification quite soon.
While we have made slight progress with strengthening the primary healthcare system in Nigeria, next year will be the year of PHC revitalization. In 2020, we will be galvanizing all stakeholders towards the development of a compelling 10-year investment case and development of a roadmap for primary healthcare strengthening and universal health coverage for all Nigerians.
In the area of immunization, we have seen remarkable improvement in the government commitment and also the partners coming together to support government. The coverage for immunization has actually improved, and also more commitment between the National Primary Healthcare Development Agency and the Global Alliance for Vaccine coming together to have a harmonized work plan looking at the 10-year plan.
The agenda of the president is to expand primary health care, and by now we have about 40% of them revitalized and functioning. But we also want to improve the capability altogether by making them functional around the clock, which means you must have light, you must have water, and must have quarters for the staff so that they can deliver service, particularly maternity services, around the clock.
In terms of disease outbreak, 127 Nigerians are said to have died from Lassa fever in 21 states between January and April in 2019, while the yellow fever outbreak recorded in the year, according to the World Health Organization, tripled as a total of 4,189 suspected yellow fever cases were recorded from January to December 2019. Nigeria's efforts to meet its human, animal and environmental health challenges led to the development and launch of the One Health Strategic Plan that integrates human, animal and environmental health management for improved health security.
We have done quite well in the area of public health and public health security. The Nigeria Center for Disease Control has taken up very well. They are doing a good job of keeping the country safe from diseases of public interest. The health sector plans are mostly for 2020 of the activities that we want to carry out.
We have now developed a plan. This is what we have. Health security, like everybody has said, is not only a national responsibility, it's a global responsibility. From my slide, you saw the amount of travel that we all do. We travel the most on the continent. We have several international airports. People are always on the road. So it's in recognizing that as a joint responsibility that we will now call on our partners to please look at the plan that we have put together, organize yourselves so that you pick the different pockets and invest in the areas that you think you are most well positioned to address.
We have seen also remarkable improvement in the way government also addressed the issue of yellow fever outbreak in some part of the country, like in Bauchi, in Katsina, the Nigeria Center for Disease Control and also the state level primary healthcare agency have worked together to tame the outbreak.
The Nigerian government launched what has been referred to as the largest HIV and AIDS survey results for people living with HIV and AIDS, known as the National HIV and AIDS Indicator and Impact Survey, NICE result. By the launch of the survey, it became clear that the burden of the disease has reduced by almost half, bringing the prevalence to 1.9 million against the 2014 data.
All of us, we've really done well. We are not yet there, but 2019 was significant for us. Number one, we were able to deliver on the largest survey, household survey, done anywhere in the world in record time. And the results were announced by the president. That is significant because it gives context to the epidemic in Nigeria. We now know the size of our epidemic. We know we can measure our success, how far we have gone. We also know what is outstanding that we need to achieve. And we know where all of these are. That, for me, is the major milestone that we achieved in this outgoing year.
While some positive steps were taken in the right direction, health watchers highlighted the major areas in the health sector with very weak performance, which they said must be addressed.
We need to improve on the healthcare personnel that are in these facilities. They need to be there. The second thing that we need to do is we need to find everyone. Those who have not been tested, we need to motivate them to get tested, to discover their status, and if they are positive, to enroll them. So we have more work to do in creating awareness. We cannot tell people, we are not saying that everything is okay, so that our case does not become like Uganda, where there was a rebound. They thought that they already turned the corner, but people became relaxed. People forgot the behavior change. They became complacent and they abandoned the right thing, and it resurged. We really need to control this epidemic for all of us to rest. We need to normalize HIV and collapse all the industries around HIV so that it goes into the health system. What are our challenges? We should be on 95% of people who know their status. We're still way behind. We're just doing about 50%. We're still way behind in terms of enrolling everyone. At least 95% of those who have known their status, we're still way behind. We're just doing 55% of enrollment out of the total number that we should have done. And in terms of remission, that people who are on the drugs and are consistently using the drugs to the point that the virus is undetectable in their system, yet it's there, but it's no more detectable. It is when it is suppressed as that we can prevent transmission. Once the virus is no more detectable, it's not possible to transmit it. We're still not doing well around that area. And that's because the health system is weak. We need to strengthen our health system. If the universal health coverage, if it takes off fully, if we're able to push the national health insurance and the state health insurances to particularly take on HIV and AIDS, we will be good. We will be good because that is the space that is remaining for us to capture.
The secondary healthcare level is a bit weak, and will require collaboration, particularly with state government and the private sector. The tertiary healthcare is in need of reforms. We all agree on that. All citizens and even the medical directors agree that the governance structure should be improved for more efficiency. The boards are trying hard to supervise the hospitals and also the regulatory bodies to see how best to get efficiency out of them. The end result of non-functional tertiary healthcare is that people want to go outside the country, what they call medical tourism, because of loss of confidence in the system. And we're also commissioning a study to look at what actually drives people out of the country to seek healthcare in India or Egypt or anywhere else. But off the cuff, some of the reasons are very simple. People complain of things as simple as the cleanliness or as simple as the attitude of staff. Those ones have to be corrected internally. And then there are also questions about the capability and the skills of the staff, which I don't think is really that strong, because the staff are quite skilled. When put to the test, they are knowledgeable. And also the equipment. I don't think, there are some equipment which are lacking, but we are not making the very best use of what we have. We have equipment that could also be able to deliver, not delivering as well as we should. So the entire reform that will advise us on a governance system that will work best is what we are going to be looking forward to. We know that hospitals in major cities like Lagos, Abuja, Port Harcourt have one set of problems, and the federal medical centers and teaching hospitals in more rural areas have a different set of problems because of the income level of the people they have to attend to. But all of those will have to be factored into the reforms that are going to come in within the course of this year we're entering.
The Basic Healthcare Provision Fund, 45% of that fund is supposed to take care of primary care. Even the 50% for health insurance is for basic healthcare package, which is part of primary care. So that, in terms of funding, we have that. But more importantly, what we have done is we look at it that our challenge is not infrastructure in primary health care. We have a lot of abandoned, either incomplete or those that are completed but are not put functionality. So in the 2020 budget for health, about 60% of capital budget for health is for primary health care. In fact, the executive, what they proposed, the legislature increased primary health care budget by about 13 billion to be able to address the infrastructural gap, the equipment gap, drug gap, as well as human resource gap. Specifically on human resources, we are reintroducing in 2020 the midwifery service scheme, which was started one time but was stopped. We are introducing it because there are human resource gap, particularly skilled birth attendant problem in hard-to-reach areas of the country, particularly in rural areas or areas that don't have infrastructure. So there's a budgetary provision for this midwifery service scheme in 2020, which will give improved access in terms of human resources, and it will make more access to qualified or skilled manpower for midwifery services. But the budget that I'm talking about, what we have done is, in that budget, we pleaded to most of our colleagues in the National Assembly and across to say, don't start any new project. What we want is for people to identify existing primary care centers that are in their vicinities, in their constituency, and make it functional. Look at what is the gap. Already the National Primary Development Agency has developed prototype framework in terms of buildings, equipment, and infrastructure. And what we said is, assess what is in your area, look at where the gap is, and what is in the budget now is filling that gap to make the primary health care to function. We also look at how to improve the human resource, how to improve availability of drugs and supplies that will make it. I think the horizon for health in 2020 is quite bright, based on all these initiatives that I mentioned, both the Basic Healthcare Provision Fund as well as the capital allocation for primary health care.
In 2019, that's also kudos to the government and the people of Nigeria. We have seen also this year, for the first time, implementation of the Basic Healthcare Provision Fund has also fully taken up. There are challenges, of course, but 2019, some releases were made in May to support the three gateway of the Basic Healthcare Provision Fund to implement the program at the national and also at the state level. So these are some of the areas we could say really 2019 has been remarkable, and we hope that in 2020 we hope to see more activities, more energy, more partners coming together to partner with government, and also we shouldn't create silos activities but working together. The budget also in 2019, as we move to the 2020, it's not only about allocation now, but talking about releases. So we hope in 2020 there will be more releases of the health budget, so that more activities also can be done. In 2019, the Basic Healthcare Provision Fund was released in May, the first tranche of the 2018 budget. So we're hoping that in 2020 we'll see more, so that life-saving drugs will be available at the facility level 24 hours a day, 7 days a week, so that the infrastructural development, both at the secondary care and also the primary care, will be done. We have seen also in 2019 support to cancer through catastrophic funding for cervical cancer, breast cancer, and the prostate cancer. As we move into 2020, we hope to see more implementation of this catastrophic fund so that more people, the women and the adult population of the men, will have access to cancer services. We also hope to see in the 2020 the midwifery service scheme, which is now captured in the budget. About 2 billion naira is allocated for that. We hope to see releases and also more midwives recruited, employed, and also distributed to all the rural area in Nigeria. So this is what we hope to see in 2020.
And we hope that by this year the National Health Insurance law will have been signed, and the assent of the President is being awaited, and will allow them to now expand their pool of services, increase coverage to at least 20-30% in the next couple of years. And we also hope to be able to continue with our gains in the public health sector, because public health is very important. I'm talking about health security, where every country is worried about disease importation. So we are guarding our borders very carefully. We check all people coming in through our airports. And in fact, the other day I was asking about the seaports, whether they have the same amount of alertness in the seaports and also the land borders. So we are worried about disease importation, but the NCDC is doing quite well about that. And then also response to outbreaks that we have seen here in country, Lassa fever, measles, and so on is rapid, and they are continuing to develop and improve their skills. But in the course of the year, we also hope to be able to test run something that is new, that is an emergency medical treatment service, which we have been working on, which is not in existence here in Nigeria yet, and is to be able to provide Nigerians with a emergency medical service when they need it, particularly after road accidents and also during other emergencies like childbirth at night, which is not requiring medical attention, or any kind of medical emergencies that occur in the home or in the industry or at odd hours, so that you can call a number and that number will bring an ambulance to you with a medic on board, a paramedic, who will take care of you and then take you to an urgent care center. I understand that only 2 countries in Africa have that at the moment, and that India is just developing its own emergency medical system, and we want to be able to look at that example and be the 3rd country in Africa that has an emergency medical system.
The health sector took cognizance of the contributions of the Nigerian Television Authority in the fight against HIV and AIDS, as it bagged awards at both corporate and individual category. As you make your way through the year, we would like you to have it in mind that living a healthy life goes beyond what's on your plate. What you eat is certainly important, but a healthy lifestyle is also about feeding the other areas of your life, such as your career, relationships, exercise, and a healthy spirit. And that does it on this episode of Health Options. A quick reminder that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah. Many thanks for watching. Hope to see you again.